BA5. How bad will this wave get?
Well, clearly it needs to be taken seriously because the BA5 variant has what we call a transmission advantage over the prior variants in that it has the capability of spreading from person to person more efficiently because it evades some of the protection that you would get from prior infection or vaccination. And that's the reason why you're seeing the uptick in cases and even in hospitalizations and a small percentage of an increase in deaths. The good news about this, or I wouldn't say good news, but the somewhat comforting news about this is that vaccinations, and particularly vaccinations with boosters, does continue to protect quite well against severe disease caused by all of the subvariants, including the BA5. So if a person is vaccinated and fully boosted with their boosters up to date, the protection against infection because of the high transmissibility is not optimal, but what is pretty good and holds strong is protection against severe disease. So it's something we take seriously, but we do have tools to counter it.
Doctor, people are being encouraged to get back in the office. President Biden, right down to local officials, including Mayor Eric Adams here in New York, want people to get back to work, get back into the office. Is that the right message to be sending now, or is it a dangerous one?
Well, it depends on what you mean, Joe, by back into the office. I mean, I am right now in my office at the National Institutes of Health. I'm alone now in this room. But when we have people who are coming in and out, who are here on business, we're wearing masks. Because if you're in a zone of a county or a city or a state where the level of infection and the dynamics of the infection is high, that when you are in an indoor setting, it is advisable and recommended that you wear masks. So people should not confuse coming back to work with wearing a mask or not. You could come back to work and still wear a mask and do your duties and jobs just the way we do around here. I'm only without a mask now only because there's no one in the room with me.
So what's your advice to companies trying to update their COVID policies? Should work from home, for instance, still be an option for workers? As I walk around different buildings, I'm seeing plexiglass go away. I'm seeing masks come down, Doctor, and I'm sure you are too.
Yeah, and I think, Joe, we have to make sure that we don't see one size fits all. It really depends on the circumstances of, first, the location and the dynamics of the outbreak where you are. And there are a large country, and if you look at the map, there's different colors. There's green, there's yellow, there's orange. So that has to be a consideration. So also, I think the prerogative of people who are the owners or the people who are in control of certain enterprises have the prerogative to make a choice as to what their requirements would be. And there are some that are going to say masking is required, but that is a local decision that often gets confused with a national or federal decision. It's not. It's a local decision. And what we do is that we recommend that the people who are responsible take a look at the guidelines from the CDC and follow to the best of their ability those guidelines.
What do you tell people who are waiting to get a booster shot this fall, Doctor? Should they not wait? Should they get one now? And will you move up a program of initiatives to try to get people to boost before the fall?
Well, of course. And I think that depends on when your last shot was. So if you are a person who is fully vaccinated, quote, with 2 mRNA vaccines, and you have not gotten your booster shot, you should definitely get your 3rd booster shot. If you are 50 years of age or older, you should get your 4th booster shot. And the FDA right now is under active consideration about whether people younger than 50 years old should get their 4th booster shot. So I believe that if you're 8-9 months from your last shot, you should not wait until the fall to get your booster shot.
Got it.
You could get a booster shot now, and then 2-3 months later in the fall, if an upgraded or an updated booster becomes available,
get another one
that's more specific to the circulating variant, then you could get that also.
You mentioned people over 50. We ran a headline a short time ago. The UK will be providing boosters to people over 50 free as cases rise there. Should the U.S. do the same?
Well, boosters are free. I mean, you don't pay for a boost. So, I mean, I think there's this confusion. The United States of America has spent billions of dollars not only helping to produce, but purchasing the vaccines from these companies. So people should go get their vaccine.
Yeah.
It is not something that is costly.
There's the matter of funding for these vaccines as well. Dr. Fauci, I'm sure you're well aware of this. There was a concerted debate in Washington several months ago after the White House made a request for what I believe was $22 billion. That request came down to, after some negotiating, about $10 billion. And we were told by the administration that therapeutics would begin running out months ago. And as we now approach Labor Day, that vaccine supplies could be impacted. How concerned are you about this?
I'm very concerned about that. And that's the reason why you hear all of us, myself included, out there saying we really do need additional funding. First of all, Congress has been very generous with us in the past. So we don't want to give the impression that we're not grateful for the support we've had.
Yeah.
But if we want to continue the effort at a more than adequate, but at an optimal level, we are going to need more resources. And that's the reason why we're urging Congress to please consider getting to the point where we now can say, here is the resources you need, and not wait any longer and hold back on it.
It's amazing to me, Doctor, that after more than 2 years since COVID emerged, the number I have today is 67%. 67% of Americans are fully vaccinated right now. At a rally last weekend in Alaska, your former boss, former President Donald Trump, was talking about this. He wouldn't even use the word vaccine as he was attempting to take credit for them before the crowd. And some people actually booed him as he talked about it. These are very passionate supporters of Donald Trump who are booing this idea at an open rally. Is it possible to ever beat COVID if that much of the population refuses to be vaccinated?
I'm very concerned about that, Joe, because we are, as you mentioned correctly, we have 67% of the population that's vaccinated, and only 1/2 of those have received the necessary boost superimposed upon that. If you compare us with other countries in the world, we rank relatively low with regard to percentage of our population. This is really so unfortunate, sad, and really is dangerous to the health of the country. We have a highly effective and safe intervention in the form of a vaccine and boosters associated with it. The fact that we are not 90+% vaccinated is very unfortunate. If you look at the difference in hospitalization and death between vaccinated and unvaccinated individuals, it's extraordinary, heavily weighted towards the unvaccinated people when you talk about hospitalizations and deaths. That is entirely avoidable. These are avoidable hospitalizations and avoidable deaths. And it just seems almost incomprehensible that we have the resources here and we're not utilizing them.
So would it help if Donald Trump kept talking about it, maybe use the word vaccine, remind people that he is fully vaccinated, or are we beyond the point of recovery here?
Well, I just think anything that we can do to get people who are not vaccinated and those who are vaccinated and not boosted to go ahead and do that.
Yeah.
And you don't want to be pejorative about it. You don't want to put them down, but you're trying to get them to appreciate how important it is for your own health, for those of your family and your loved ones, and also your communal and societal responsibility to get this outbreak under control in the country. And you can do that, and you get a twofer. You protect yourself and you help your community.
Enter monkeypox, doctor. I know you've spent some time talking about this. The CDC added 400 new cases to their tracker overnight. That's a pretty big jump from 1,000. Do we need to have a more concerted conversation about monkeypox vaccines and therapeutics?
We are having a very concerted conversation about this. This is something that's the highest level of priority. We have vaccine doses that are being shipped now from the place of its not development, but its production in Denmark. And hopefully in the next week or so, we'll have hundreds of thousands more coming in. We need to get the people at risk vaccinated. We have good vaccines for it, and we have antivirals. We need to do better in that. We need to get those doses available to the people who need them and who are at risk. Yeah. And that's not only a topic of conversation, it's a topic of an increased effort over the last several days to weeks.
The CDC is asking for expanded access protocol to use Temboxa as a backup treatment, knowing that it has some very serious side effects. Doctor, is that worth pursuing?
Well, we now have TPOXX, which is a very effective and was developed by the NIH and a company in collaboration. And that's the drug that we are really hoping people would be able to use more of because it's quite effective against monkeypox.
Mm-hmm. How concerned are you about this becoming something larger? Obviously, the way we're interpreting this is being informed by our experience over the last 2 years with COVID. I suspect it would not have been that way if it were not for COVID. Put it in context for us, Dr. Fauci, about how much of a concern, how much of a risk this is.
Well, we do not want to get this to spread any more than it's spreading. This is something we have to take seriously. It is an infection that is unfortunately much more heavily weighted and concentrated among men who have sex with men. We want to make sure we, first, do not stigmatize anyone because of a disease that's spreading in a demographic group. Yeah. We want to inform people of the risk. We want the physicians who take care of individuals to recognize this early so that they can adequately take care of it. But importantly, we want to get the population vaccinated. We don't want this to be spreading any more than it is spreading. And fortunately for us, we have vaccines and we have antivirals, and the testing is going to be dramatically expanded because just recently we now have 5 commercial groups that are going to be out there multiplying multifold the availability of testing.
I have to ask you before you leave us, Doctor, about a little controversy involving President Biden's trip to the Middle East. And I'm not going to ask you about politics. I'm going to ask you about handshaking. The fact that the White House initially said he'd be fist bumping. This was turned upside down when he decided to shake hands with Benjamin Netanyahu. Apparently, it was a fist bump for MBS in Saudi Arabia. I won't ask you about the president's own behavior, Doctor, but should we be shaking hands with people again?
Well, I'm not going to talk about what the president should be doing or not. He is quite protected. He's vaccinated.
How about the rest of us?
He's very carefully. My own self is that if you are in a situation where you don't know the status of an individual, you should do what you can to avoid contact that might be spreading infection. I mean, I don't want to be on record saying you shouldn't be shaking hands. That becomes a soundbite that gets out of control.
I'm not trying to get you in trouble, but are you putting the elbow up for greetings? Do you fist bump? How do you handle it?
If it's somebody that I know very, very well and I see every day, I don't mind that. When I see somebody that I don't know, I would just as soon give a fist bump or not shake hands at all.
Got it.